Here's your opportunity to ask questions. It's Ask the Expert with Robillard Hearing Centers. Give us a phone call at 613-789-6559, extension 2803. You can email questions, ottawa.morning@ctv.ca, or CTV Ottawa Morning Live is our Facebook page. Feel free to ask those questions. We're here with JB Robillard, and Monica Nazar is here. And also, we're going to talk more about technology that has come a long way. And my question is this, and it applies to people who already have had hearing aids for a long time. Mm-hmm. Is it worth coming in to get checked out? Obviously, you want to make sure your hearing is okay with the hearing aid, but to move into a different area of hearing aid, so the advancements in technology can help out even more.
That's right. What we're seeing with the new developments is the circuitries, the hearing aids are getting more sophisticated, and they're able to correct more of the hearing loss. So very often, even though somebody has a hearing aid, despite having the instrument, they still have a remaining hearing loss.
Right.
So that means they, on occasion, they'll still have difficulty hearing. And so with the newer technologies, I mean, they're allowing the clinicians to be more aggressive in addressing the hearing loss.
Yeah.
And therefore just correct a greater portion of the hearing loss. So the new technologies are helpful. There's no question.
As an audiologist, you must have seen people who have had hearing aids for a long time and come in and gotten the new technology and saw immediate improvement?
Absolutely.
Really?
And if you notice with that recording that we played earlier, how the speech sounded clean and just natural. With older instruments, they weren't able to preserve those natural fluctuations in speech as we now can.
Right.
So we can filter out the noise, but still preserve that natural fluctuation in the variation levels of the speech, which is important for normal conversation. Some instruments in the past, it was more monotone. So that's something that people have really noticed is a lot better.
The technology is helping you do your job, and in turn helping people hear better.
Absolutely.
Right?
Yeah.
It makes a big difference. You brought along some examples of that today, and I've got this nearly invisible. Now, is this still behind the ear? This one?
It is. Yeah. That's a recent instrument. It's fairly new.
Right.
So it's quite small. It goes behind.
Well, here's my finger. There's how big it is, right?
That's right. So it's designed to be invisible, it's actually called a receiver in the canal. And so what it uses is just a small dome that goes inside the ear canal. And it's typically a very, very comfortable instrument. It doesn't obstruct the ear canal at all, so most people find it very comfortable.
Right.
It's a type of instrument that is, most people, it's probably the easiest hearing aid to get used to.
Right. You brought some other examples. This really points out the differences in technology and what's available, right?
That's right. And so these are just the different sizes, the different styles. So when we're selecting an instrument, it depends on several factors. One factor could be just dexterity on behalf of the patient. So if we have somebody that has a greatly diminished dexterity, then we might want to look at an instrument that's a little bit bigger, for instance, such as the ITE, depending on the preference, of course. But the circuitries are getting more and more sophisticated, and they're also getting smaller and smaller.
Right.
So the trend, of course, is more in this direction. So what we're seeing
more in-ear than outside the ear?
Yeah, there's a lot of development with that circuitry. So the IIC is a good example.
Like you see here.
Like you see right there.
And this one we touched on earlier, this really gets inserted deep into the ear canal, correct?
It does, yeah. It does exactly, and it's just a few millimeters away from the eardrum.
I'm just going to turn it so we can really get a good idea of how far in that is. Okay.
Yeah. So it's completely invisible. It's designed to be invisible.
Right.
And
yeah, you would never see that.
No, you can't really. And it's despite the size as well, it's very sophisticated. I mean, it uses the most recent circuitry. So it's.
So it starts here and it ends around here.
Yeah.
So very close to the eardrum.
Very close to the eardrum, just a few millimeters away, and there's looking inside the ear canal. I mean, you can't actually see it. It's because it's so deep.
So if I looked in your ear and I wouldn't be able to see it?
You couldn't see it, no. You couldn't see it. Yeah.
Wow.
Yeah.
Now, all of this depends on what type of hearing loss you have and what the causes of that hearing loss are. Would that be correct?
That's true. That's true. Yeah. I mean, there are some limitations to the very small instruments, such as the IIC. I mean, they're not as powerful, but the developments have come along to the point where we can treat somebody with a severe hearing loss.
Yeah.
With a profound hearing loss, no, but with a severe, we can. So it's really quite flexible. It's got a great range.
Okay, we do have one Facebook question that has come in so far, so we'll address that one now if we can get that question up. Having a lot of ear infections as a child, will having a lot of ear infections as a child affect your hearing later on in life?
It's possible. In rare cases, when someone has had so many ear infections that their eardrum becomes a bit scarred, so there can become some scar tissue on the eardrum. In those cases, it can cause some hearing loss.
Right.
But
is that rare, would you say?
I would say.
Yeah.
Yeah.
It's uncommon.
Yeah.
But during our testing, during our evaluation, that's usually what we determine, and not only the severity of the hearing loss, but also the nature of it and its origin. So with somebody that's had ongoing ear infections, so typically that would be associated with the middle ear, with the eardrum, and the aceticular chain. Right. And so we would be able to determine that within the test. And also that type of hearing loss can sometimes be corrected through surgery, depending on the severity. So,
it depends on the reasons for it
There's a lot
and the treatment that you get. Right?
That's right.
Yeah, that's really a case-by-case thing with ear infections.
We'll talk more about that and any other questions you have about hearing loss and how to help you or someone you know. Give us a call at 613-789-6559, extension 2803. Email or Facebook us. Our final segment on Ask the Expert with Robillard Hearing Centers is coming right up. We're right back.